My name is Billy Benevsky and I'm a behavioural scientist at the University of Newcastle. Well, I fell into research. I was determined to be a clinical psychologist because I'm interested in people. But what I like about research is that what I do impacts on lots of people. So whereas as a clinician, you work one-on-one with a person, with my research, I can implement it across settings and communities, and it impacts lots of people. So we have grants that were focused on particular settings, treatment settings, and one was called the Call It Quits trial, which worked with community social services. So they're not even health settings, they're social services that help people with housing or financial aid. And this is where we find that smoking rates are the highest now. And we developed a grant to determine whether we could address smoking in that type of setting. They were very successful. People reduced their smoking, they made more quit attempts, and we can address smoking in non-health social services. We also recently received a grant to address tobacco smoking in drug and alcohol treatment services. Really big, important outcomes because smoking rates amongst that population are amongst the highest in Australia. There are reports of up to 95% of people in drug and alcohol treatment smoke tobacco, and tobacco is what they're most likely to die of, tobacco-related diseases. So cardiovascular disease, diabetes, chronic respiratory diseases and cancers is what gets people in drug and alcohol treatment. So with that trial called the TNT trial, we showed again that we can increase, with an organisational change intervention, we can increase the delivery of smoking cessation support to clients of drug and alcohol treatment services. And again, we showed that they increased their quit attempts and we reduced smoking as a result of that study. And the trials are actually implemented in health services or out in the community with our health partners. So even at the point of doing the research, the translation's already starting. We're training staff, we're building the capacity of health services, we're changing systems, so that when we walk out at the end of the trial, those systems changes and those practice changes, they continue on. So I think that involving your research end user right from the beginning and responding to their needs increases the likelihood that your research is going to be used at the end.